Hello, everyone. Thank you for joining us for this HoodMed chat. In this community focus series episode, we chat with a group of Native Hawaiian organizers and health professionals about how they are working to keep their community safe during the pandemic. My name is Dr. Neecey Hudson, and I'm the chair and science director of Hood Medicine.
I'm Jonathan White, co-founder and director of policy.
Hood Medicine Initiative is a collective of scientists, physicians, hackers, and assorted geeks dedicated to protecting Black and Brown lives throughout the pandemic, reducing health disparities for all vulnerable populations, and curbing the spread of misinformation.
HoodMed Chats, our signature event, is an effort to bring expertise of healthcare professionals and others to those communities. Our goal is very simple: help us, save us.
Today, we are so excited for our panel. We're honored to welcome Mel Raposo. He's a special investigator for the County of Kauai Prosecuting Attorney's Office. He's a co-host of the Mel and Charlie Live Show, a community-oriented podcast that has recently been focused on pandemic issues facing local communities and how state policies are failing to protect them. He's a former Kauai Police Department officer and was first elected to City Council in 2002 and served into 2008. When he was reelected 2 years later, he served until his term limits, acting as council chair for his final 2 years in office in 2018. Thank you for joining us tonight.
Aloha. Thank you for having us. Thank you for having us.
Yeah, we also have the other half of the Mel and Charlie Live Show. Charlie Iona is with us tonight. Charlie is a former chairman of the Kaua. Sorry, can you say the name for me?
Okay, Kauai.
Kauai. Okay, Kauai Police Commission, and works as a certified CPR and first aid instructor and a consultant for the Star Protection Agency, as well as president of the Pono Business Solutions. Thank you for coming with us, Uncle Charlie.
Thank you.
We also have Dr. Kapono Chong-Hanssen, who serves as the medical director for the Lāhui Hawai Kauai Community Health Center, which is
doing better than me.
Take notes, Jonathan. Take notes.
Right.
Putting me to shame tonight, Neecey. Putting me to shame.
Oh, sorry. Which is both the Native Hawaiian Healthcare Systems office for Kauai and the only federally qualified community health center primary care safety net on the island. He's a recipient of the Native Hawaiian Health Scholarship and attended the University of Southern California Keck School of Medicine prior to family medicine residency at the University of Hawaii. And he's a board member of the Ahui and Kauka, I don't know, Association of Native
We're
Hawaiian
really going to challenge you. Yeah.
I know.
Ahui ona kauka. Yeah.
Ahui ona kauka. Association of Native Hawaiian Physicians, serving as the chair of the advocacy committee. Thank you for joining us.
Thank you for having me. Aloha to all of you. Aloha to all the viewers.
Aloha. Angela Keene is a longtime TV news personality and journalist in Hawaii. She spent more than 15 years at KGMB 9 News and later KHNL News 8, anchoring the morning show. Her focus is in news has always been health and medicine. In 2007, Angela left TV and got her training wheels in communications and marketing. She joined Straub Clinic Hospital in 2008 and later moved over to Shriners Hospital in 2014, where she worked as director of marketing, communications, and business development for Hawaii, Guam, and Pacific Basin. Angela was permanently laid off in June and has been spending all of her time leading the community action volunteer group called Hawaii Quarantine Kapu Breakers. In the Hawaiian language, a kapu breaker is someone who breaks laws or rules. The group made international headlines after helping authorities catch and arrest travelers who broke mandatory quarantine. Her group works with the Attorney General's office and has more than 6,500 members statewide, including Lanai. Did I say that right?
Yeah.
Okay, there we go. I'm working on it. You're muted.
Oops, sorry. I said we're going to get it right by the end. Um, and last but certainly not least, Melissa Bolton is the Director of Community Care at Hood Medicine. She's a patient service representative and advocate based in Honolulu who works tirelessly coordinating patient care and ensuring the underserved in her community have access to critical care and basic needs. She's focused with Hood Medicine on developing programming to provide pandemic relief to struggling communities. Our resident Robin Hood, thank you for joining us, Melissa.
Hey, everybody.
It's our first Hood Med chat.
I know. We have arrived.
This is truly an all-star lineup.
Right.
It is. Believe me, everyone on this panel, they're all stars. I'm so proud of them.
We were hoping to discuss the impact of COVID among the diverse Native Hawaiian and Pacific Islander communities tonight. I wanted to start with you, Dr. Kapono, and talk about where you guys are at now in terms of infection rates, the hospitalization capacity, like what's the landscape looking like right now?
I mean, we're in pretty good shape. We rejoined safe travels beginning of April, which probably we need to explain some context having to do with that. But really, I got this hat on because right now, we're really just trying to get our vaccination rates as high as possible. One of the things we did by opting out of safe travels, and like I said, I think maybe we'll get into the details of that later, is it led to really low case rates on Kauai, even in comparison to the other islands. And it allowed our public health officials to really focus on rolling out vaccinations. So we were leading the nation and leading the state in vaccination rates. And now kind of everyone's starting to catch up with us. We're running into that different segment of the population that isn't so eager to be vaccinated, not necessarily anti-vax, but maybe, just not a high priority for them, trying to get into the younger age groups. And that's kind of why I was going to show you guys my hats. One thing that we've been doing is trying to create some gear. I don't see it so much as an incentive, as a reward, for our community for all the work that we have done, but we really tried to make it appeal to our younger population. So it says, get jabbed, protect Kauai, knock out COVID.
I love it.
Awesome.
You're gonna have to drop the link in the chat so we can share it with people. What?
I will. So we have this shirt. We have another one coming out with the red, gold, and green next week.
I love it.
But we did the safety colors with orange and yellow, and we have on the sleeve we have our where you get vaccinated to try to kind of get the message across.
That's so cool.
It kind of hits one of the interesting things about our community. We have a lot of Pacific Islanders and Native Hawaiians who work as essential workers. So we have sort of a fashion that is come out of like construction workers and essential workers that wear these, safety kind of, colors. And you'll see, even with like the reflectors, these aloha shirts with flower prints, and you'll see, like our people out working, fixing Hanapepe Bridge and everything, and they're kind of expressing themselves that way. So, that's kind of something that it's relevant to the pandemic, and we thought that was a good way to, reach out to people. And it also was, we have 3 high schools on the island, and one is blue, and one is red, and one is green, and you can't pick one, or else, the other ones feel a little bit slighted. So we tried to kind of like, pick something that would be kind of neutral. So we went with those safety colors. But that's where we are. We're really trying to, I tell people, we feel like we have COVID on the ropes. We're trying to knock it out by getting the highest vaccination rates that we can. But we've also it was just released that we have the Delta variant here on Kauai. It's essentially, I think it's on all the islands in Hawaii right now, so we're trying to help people understand that just like we're learning, we're adapting to try to beat this virus. The virus learns and adapts in a different way through trial and error, but it has trial and error, millions and billions of times to try to find ways to get past the things that we've done to get it under control. So that's really where we are. We're doing community clinics. I was just at Rob's Good Times Grill, which is kind of one of the most popular bars and eateries on the island. And there was actually cluster when we re-entered Safe Travels in April that was associated with the establishment. So that has been a really nice thing. Through Mel and Charlie's show, they have created this forum that is, I would say, Kauai-centric, but not exclusive to Kauai. You know, other people are watching from all over the nation, but all over Hawaii too. And they gave this forum where I think people could share what was going on, and they brought on a guest, and she shared. I mean, she was kind of like patient zero for this mini cluster, but she shared publicly where she had been, and our county was smart enough to have offered free testing. So this little cluster that we had that started when we came back from Safe Travels resulted in a huge outpouring of testing. And I think we were able to really clamp down on that because our community is small and because there was a venue like Mel and Charlie. But I think also we have been able to help people feel like you don't need to be ashamed that it happened. You know, like, I mean, this thing is very, very tricky. It spreads easily. The best thing you can do is be open about it and let everybody know that could be at risk to get tested. So that's where we are, and just getting the vaccination rates high. We still have some little pockets here and there, mostly associated with restaurants and places of worship. So like next weekend, we're going to be going to one of the churches on the island to offer a pop-up clinic. The Department of Health has some outreach vans, and they're going to start focusing more on restaurants. It just has to do with kind of like which kind of places have more space to be set up for vaccination clinics.
Dr. Kapono, can we step back a couple of steps, and can you tell us about Safe Travels Hawaii? Is that a protocol in order to safely travel to Hawaii? And then why did Hawaii opt out of Safe Travels for some time?
Yeah, so we were in this unique position. You know, Alaska is somewhat like Hawaii, but you know, we're unique that we have this geographical isolation between, we call it the mainland or the continental United States, but you know, not just the United States, other countries. And so when the pandemic started, if you're in that position and you don't have any cases yet or low case rates like Hawaii did, you're in a position where you can really control what's happening by controlling travel and making requirements for people who want to travel to Hawaii. And a lot of what I learned from, or what, you know, the people that I was associating with were looking at was like what New Zealand did, or Native Hawaiians tend to call it Aotearoa, the long white cloud. The Maori from New Zealand, we sort of think of them as our cousins, but also sort of like our little cousins, because the canoes that went to Aotearoa probably came from Hawaii. Those people, the Maori say they came from Hawaii. And we say we came from Kahiki, which means that a lot of our people probably came from what we call Tahiti or French Polynesia. Okay. So we were in this position, a unique position, where we could, if we controlled travel and made it safe, we could keep our people safe. And when I first wrote an editorial with some help from Joanne Yukimura, who used to be the mayor of Kauai, we called Kauai a kipuka. And a kipuka, the best translation is an oasis, but it really refers to a place when there's a lava flow that kind of just runs over an area. There will be sort of random areas where it skips over the vegetation there, and there will be this kind of pocket of life in the middle of all this devastation. And that pocket of life eventually repopulates all of that area and becomes sort of like the new thing. So I had a friend who had said, he says it was he calls it a kapu aloha, but his reaction to the 2016 election, he said Hawaii is going to be a kipuka during this time, because he felt like he could tell that there was going to be a tumultuous time coming up, you know, in the next few years. And it really, when this pandemic happened, and then we saw all the we would say pilikia, but all the trouble in the mainland United States, all of the kind of infighting between different people and arguing about whether this is true or not, the misinformation that you guys are trying to combat, that's what it felt like. We're in this kipuka, you know, and we can stay together, we can stay aligned, we can keep our community safe. So the people that I was associating with, we have some part-time residents here who are in medicine at the University of Washington, and one of them, his name is Dr. Michael Schwartz. He sort of pulled in his resources and made an analytical model about how Kauai could reopen safely. And what he was advocating for is a pre-travel test, which eventually was part of Safe Travels, a second test around day 6 or 7, and then you can be released from the 14-day quarantine a week early and then enjoy the island. Of course, you know, the tourism industry here is very powerful, and to most of them, that was a non-starter. You know, I mean, that was too rigid. But of course, we're looking at like Aotearoa, New Zealand, Australia, and they just were like, we're shut down. We're shut down until July 2021. You know, like, we're not even playing games with this. So that's what we were looking at about a year ago. And Mel and Charlie's show had already started, and they had brought on guests, and they had brought on some experts, and our lieutenant governor, who is actually an emergency medicine physician. And he is, everyone kind of knows he's making a bid to run for governor when Governor Ige comes out of office. So in the beginning, it seemed like he understood the value of a 2-step testing program, which has been implemented in many other areas around the world, or beyond 2 steps. Some of them were doing 3, 4, you know, people that were really safety oriented. And so later on, something happened with this lieutenant governor of ours. He caught COVID, and it seemed like it erased his memory of the understanding. And he started advocating that a single pre-travel test 72 hours before arrival would be adequate to keep our communities safe. And a lot of us did not agree. And I was one of those, you know, and I was pretty, you know, outspoken about it. And a lot of doctors, I think we were outspoken particularly because we didn't like it that a doctor who was really making a political decision was sort of using the degree to sort of make it seem more legitimate. We felt like there was misinformation coming out, you know, to the public, and so we felt like we needed to combat that somewhat. And I probably shouldn't go too far down that rabbit hole, but I mean, I could.
Let's dive in.
the reality in the end was that October, there were many sort of plans to reopen travel. And then October 15th, Safe Travels launched everywhere in Hawaii. In Kauai, we watched very closely to our cases and watched them start climbing. We also were lucky because our district health officer, so the Department of Health for the County of Kauai, her name is Janet Berryman. I have developed a huge amount of respect for her over the past year. And we formed a hui, really a group, an informal group, really quickly early on in the pandemic, because we had very limited testing supplies, like, you know, like 30 of the swabs to do a nasopharyngeal swab on the island, you know. And so we were all talking to each other, like, how do we decide where to, you know, how we're going to use it? And you know, through that networking, we started having a lot of I think good constructive communication between the hospitals and the other medical providers on the island. So she, you know, was receptive to what we were saying. It's not like she just listened to everything we said and did whatever we said. We also had Mayor Kawakami, who was also receptive, at least, you know, would listen to what we had to say from the safety standpoint. It wasn't completely beholden to the tourism industry the way that it appears to be with some of our other politicians. So we saw these case rates climbing in October. We also were public about things like travelers that had tested positive on their pre-travel test, but still traveled and arrived, and how often that was happening, because, you know, then you have these close contacts on the flight, and, you know, what to do with those people. The other counties weren't so forthcoming about that. So by the time we were getting into December and anticipating the holiday travel surge, we were all seeing that this was going to be a problem. And thankfully to Dr. Berryman, she actually wrote an op-ed too, saying, you know, the tsunami is coming and we should not be doing this. And our mayor opted out of Safe Travels in the beginning of December. So he implemented a different program that lasted all the way until April. And essentially that program was that if you want to come to Kauai, you need to do a pre-travel test, and then you can stay at what was called like a bubble resort. So you can stay at the hotel. You're not stuck in your room. You can enjoy certain areas of the resort, and then you need to have a second test on day 3 post arrival, and then you can be released from quarantine. So I think that really saw us through until April, and that was a key to why Kauai fared better than Maui, for example, which is probably the most similar island to Kauai. And you saw their case rates really go through the roof. The California variant, really just ran through that county.
Yeah. Angela, I wondered if you could follow up and talk a little bit more about the safe travels and the work that you've been doing to help local government enforce those policies.
Thank you. Thank you. It was an interesting experience. In the very beginning, there were a handful of us, and in the group Hawaii Quarantine Kapu Breakers, and a friend of mine invited me. Little did I know I would be the spokesperson and running the group within a few weeks after that. Initially, we knew we have indigenous people and we need to protect them. I actually grew up in the Midwest in an area called Southwest Nebraska, where Native Americans and indigenous people roamed. And now they're only in museums. And for me personally, it was a great fear to know that a pandemic was coming, that we could have visitors or travelers in general coming in and out of Hawaii, and that it would put our people at risk. I don't ever want to see a situation where Hawaiians are in the museum and that's the only place we can see them. We have an opportunity to help them, to save them, to help their culture flourish. And so that was really my goal in the very beginning. And in the very beginning, it was really ragtag. We saw people coming to Hawaii on vacation and bragging about it, doing illegal things. We had a group of Gen Zers that had taken their online business and brought it to Hawaii, and they were bragging about it. And hey, our office is in this beach chair on the beach, blah, blah, blah. Our folks went after them just digitally and said, stop. And those people pushed back. And in the end, some of our members were very strong or terse with them and said, hey, we have indigenous people here. You need to respect our culture. You need to respect our people. The islands are closed right now. And it got to the point where they were so scared, these people were so scared that they actually got on a plane, got their tickets, got themselves selfies, put their photos up and said, we're sorry. We're sorry. We didn't mean to do this. We're really scared. We apologize. The leader of the group actually posted a YouTube video apologizing. And from there, I said, okay, we got to be Pono. We have to do things right. We can't just bully people out of Hawaii. We have to educate them. We have to allow them to understand why we're doing this. And we want to get their buy-in to say, hey, I care. I'm going to come when the time is right. And so that's how it sort of unfolded. One of our first people was a very well-known social media person that had some mental issues, and she had a big following of haters across the country. And they informed us that she was coming. And at that point, we had eyes on her within about a half hour after she landed, and she was not wearing a mask. She was not social distancing. She was sharing food and with elders in the Hawaiian community. She was at a camp area where elders tend to gather and camp when they don't have housing. It was really disturbing. And so from there, we got connected with a nonprofit agency who connected us with the sheriffs, who were connected with the Attorney General. We had Honolulu police involved, and they just didn't really know what to do with it. They were clueless, and rightly so. It was something new for them. They also didn't have time for it because they had other emergencies happening. So we really my group banded together with the Attorney General's office. And as soon as the founder of the group handed over to me and said, "You're the founder. I need to go back to work. I have things to do. You're better at this." I'm like, "What?" I just took it on because I lost my job. And I thought, if there's anything I can do for the community, let's make this happen. Let's be right about it. Let's band together with law enforcement. Let's get people on every island watching. And that's how it happened. We ended up getting about 85 people, most of them on Oahu. 22 of them were in a cult on the Big Island, and they were creating all kinds of chaos. And we secretly, you know, just kind of we're quiet about it. We do our work offline, and we chatter online in the private group about all kinds of things, you know, the issues that are happening with travel, the issues that are happening with safe travel, you know, where are there breakdowns in the process? Where can we get authorities to resolve it, or the state to resolve it? And we just put pressure on the state and the city and county as much as we could for the last however year and a half, to make sure that they're on their toes and they're being careful, and that they're watching the people that are coming in, and that our tourism workers and our communities aren't getting infected. And that's all about saving people's lives, really.
I love that.
Charlie, you know, we hire politicians to do the work, to serve and protect our communities, to, you know, work in our best interest, to make sure that we have, you know, better resources and more things available for our children than we have for ourselves. It seems like the folks in your communities who were in these positions of power greatly disappointed you and didn't meet the level of responsibility that you were requiring of them. And you guys got on the air and started getting to work, holding people accountable. And in many ways, it seems like you saved Hawaiians, you know, in a way that the politicians and, you know, people who were supposed to be doing that job weren't doing. Can you talk about the challenges that you saw on the island that made you, you know, feel the need to get on air and start talking about these things that people were doing to make people in Hawaii vulnerable, and put the island in a dangerous situation?
Well, you know, it was kind of by accident, actually. But you kind of hit the nail on the head as it relates to the political decisions that were being made. Back in March, when we were all getting concerned about the COVID numbers in Hawaii, and then the governor came out and said that they were going to implement a quarantine. We were the entire state, the people were pushing the governor to implement a quarantine, a 14-day mandatory quarantine for anybody coming in from the mainland, because we were still relatively virus-free. And so we're very excited. And that day, I watched that press conference. I was so excited because we were going to implement the 14-day quarantine. But it was suspicious about it was he was surrounded not by medical experts. The entire visitor industry was surrounding him as he did his press conference. He had the hotel people, he had the airlines people. He never had one medical expert. And remember, back then, Lieutenant Governor Josh Green was a different person. He was really pushing for health and safety. Anyway, he did the press conference, and when he came out and stated that he was going to allow the visitors, because he didn't want to inconvenience the tourists, he was going to delay the quarantine implementation for a week or whatever it was. I kind of flipped out. I did a Facebook Live, and in a very short period of time, it was an impromptu. I might have even cussed. But in a relatively short period of time, we had generated almost 20,000 views. And I realized that, you know what, people, and based on the comments, people really needed to get involved and engaged and push our politicians. Well, the only thing I could think of was call my good buddy, Charlie, and say, hey, man, we had no intention of having this show run for, 15 months or whatever it is. But that's how it started. And I said, Charlie, you wanna come on live with me and just let's just talk about COVID. Let's bring on guests and blah, blah, blah. And of course, Charlie agreed. And we did this every night for 7 nights a week until a few months ago where we went back down to 3 nights a week. And that's all we do. We bring experts on. We had the Lieutenant Governor. He was on one of our favorite guests because he was so pro testing and quarantine. And I didn't think about it until Dr. Kapono mentioned that after he got COVID, maybe he did suffer some memory loss, because right after that, his whole perspective changed, and it was all about opening this place up. And even while this variant has now been identified, even now, I mean, we lost, I think, 1 or 2 today, deaths in the state. We had another 1 or 2 yesterday. You know, the deaths haven't really slowed down. The cases may have dropped, but the deaths are still occurring. And now we're on the verge of opening our state up next week, or July 8th. I'm afraid. And last night we had Dr. Miskovich, who's one of the testing gurus. He's a CNN guy. He's always on CNN. And he made it very clear that we are rushing this. But yeah, that's how it started. It was off of a rant. And then, you know, Charlie, I've known Charlie for 30 years. And we have been blessed with people like Dr. Kapono, like Angela, like Melissa. And we've had Dr. Jerome Kim, International Director General for the International Vaccine Institute. We've had so many experts come on the show. Our goal is simply to inform and educate, not to bash anybody. But when people do stupid things, we make sure that people know about it. If people call it bashing, well, so be it. But that's kind of how it all got started.
I feel that in my soul, because that is also how Hood Mid Chat started.
Right. Right. Right.
Charlie, can you talk about how you guys use your platform to kind of create, like Dr. Kapono was saying, this forum where you're helping people check in and kind of contributing to group tracing in a sense to help control the spread so people kind of know where, you know, infected people have been? How did that come about?
Well, I think when Mel asked me on, I was going through a real rough period of, my brother was one of the first 3,000 that passed away from COVID in New York City.
I'm sorry.
So when Mel asked me on, I was able to give a perspective of a survivor myself who lost a family member. And so that kind of, I was trying to bring the context that, you know, if you don't understand this disease, just know this, it's going to attack you fast, because I'll give you the perspective of that. I saw a post of my brother that did on a Sunday, was late March, the ending part of March. It was on a Sunday. And I talked to him and I said, "Hey brother, what's going on?" And he says, "Well, doctor said that I contracted COVID, but I'm doing good. But I have to be, my fever has to be held down for 3 days in a row before, you know, I can do anything." I said, "Okay." Monday came along, I heard nothing from him. Early Tuesday morning, I was advised by his longtime girlfriend that he was admitted to the hospital. And I never spoke to him after that. I was given updates, and that's when we started to find out the certain characteristics about COVID. One, it thickened his blood so badly that when they tried to dialyze him, it just gunked up the machine. So they tried to ventilate him, it wouldn't work. So that's, now figuring now, he talked to me on a Sunday. By the following Saturday, my brother was gone. It was that fast. So because of that, I made it a crusade to team up with Mel. That we've got a lot of people that, and rightfully so, they're afraid because they didn't know much about this virus. So I said, you know what? I'm going to find out what the heck this thing is about and see certain things, what it does to you. So we went through that whole phase. And what we're trying to do is trying to get people on that could talk about it, like Dr. Kapono, okay, like Dr. Berman, to talk about it in such a way that it was kept it in perspective for the layperson to understand what's going to happen. And that's where we really had grown a relationship with the lieutenant governor. And, you know, not to say anything negative about him, but the fact of the matter is he took a spin on it and it kind of caught us off guard. So now we've had people in the community questioning, what is right and what is wrong. And when the confusion was built, because I always felt, both Mel and I were retired police officers. And so I felt that with the programs that our mayor had put in, it was sort of like a dragnet, right? If you're going to catch a bad guy, you put out a lot of officers and you set up that dragnet. That's what you want to do. Our mayor set up a dragnet to make sure that we've always said there's only two ways of getting into Hawaii, by air and by boat. It's going to come in one of those ways. So let's catch it. But then when all of this was happening, when they started to relax that dragnet, we knew more or less. And then when they started to blame the community that it's a community spread, it's a community spread, we got pretty tired of it because we said, hey, we're not the ones spreading the damn thing. It's coming into our state. All we're trying to tell you is give us a chance to fight this thing off so it doesn't spread. And that's where the entire show came from. We started to do that by bringing the experts. One expert, I still to this day, Mel and I, we chuckle over. His name is Murtaza Akhtar. You see him on MSNBC and CNN. And he tells it like it is. And, you know, when they had that one individual who talked about hydroxychloroquine, he called it a wackadoodle. and he made that statement. But he started to show us certain things that was happening. And one is Florida, right? They didn't want to abide by anything. Well, when they got vaccinated, he says, you go to Florida, you see more people using masks now than they did before. And that was, I thought that was kind of interesting. I said, wow, now that you've been vaccinated, you're kind of taking a spin on it. So, you know, in my sector of closing here, that's how Mel and I started, and we've had a beautiful ride. We've had Angela on several times, and we can always, and Dr. Kapono, and we can always share the new things that happen because, like I said, I'm 75% Hawaiian, and we're pretty simple. We're pretty simple people. You know, we're not into, you know, you always hear the term hang loose. Yeah, most of the time we're hanging loose. When you got something as deadly as this floating around, it kind of makes you very concerned. And our whole goal is just to say, hey, we'll put the information out. If it works for you, use it. And if it doesn't, then you just wait for the next chapter and we'll just throw some more information out again. So that's what we do. That's what we do.
It's really frustrating when you have, I mean, I know from my perspective also, like seeing a lot of scientists sort of like cast aspersions on either the vaccine development process or different recommendations. And it makes it difficult because you're confusing the audience, the message. The CDC recently just rambunctiously decided to give everyone permission to give up on containment without giving any context, you know what I mean? Like around the nuance of like, yeah, strictly speaking, you can go without a mask if you're vaccinated, but we don't, it's not in a vacuum, you know what I mean? Like there's so many different pockets of communities that are at risk for outbreak clusters because their vaccination rates are so low. They mention nothing about this whatsoever. And so it's just frustrating because then the community starts to question the science at the most crucial time for us to like, you know, try to be able to understand and trust in it. So that's hugely frustrating. Politicians too, but yeah.
Yeah,
Dr. Neecey, I think one of the bigger problems we have in Hawaii right now is exactly that, is the mixed messages that's coming from the leadership. You know, up until a few days ago when the governor agreed to open up, you know, he was taking the safe course. He was, you know, really relying on the Department of Health experts. But the lieutenant governor constantly, every single morning, he has his show on the news, and he keeps telling people that we're there, we're in a great position, and that you know, we just got to push for the vaccination so we can open up. And he's really pushing, regardless of the vaccination rate. He wants the governor to open the state up before the July 4th weekend, regardless of vaccination rate. But I think the mixed messages. So what happens is when someone listens to that, coming from an ER doctor who happens to be the lieutenant governor, I look at it differently. He's a lieutenant governor who just happens to be a medical doctor, his words carry some weight, and people tend to drop their guard because they heard it on the news in the morning that we're in good shape. And I have yet to find another medical doctor or expert that agrees with that here in Hawaii right now. More so now with the variant, there is none. And we've put the challenge out. Charlie and I both. Anyone that wants to come on and endorse that, we'll put them on the show. We'll give them an hour. Zero.
Yeah, the problem we have is, I think because, Neecey and I come from a community that has been underserved forever. We realize and recognize that when in a situation like this, you really have to focus on the most vulnerable populations. And because if those most vulnerable populations aren't protected, then the communities aren't protected. If the communities aren't protected, then there's going to be this false sense of safety, going around the country. I think that issue is even more prevalent, in a place like Hawaii, as you said, that has large communities of indigenous folks who have cultures and legacies and, a history that can so easily be lost.
Again.
This stuff isn't
again.
If it's not taken care of. Melissa, and the work that you have done, community organizing, the community work you've done, you play a special role in this, right? Because you're helping patients find resources, and you're working with patient populations, dealing with respiratory disease. What has it been like for you trying to fight off, this push by people to put money and economy over the lives of the most vulnerable people in your community?
Okay, for me, even pre-pandemic, Hawaii does not have a lot of medical resources, period. We don't, let's be honest. Certain illness, you need care, you have to go to, say, California, see a different specialty. We don't have the medical capacity to take on this this new variant. We don't. What I'm seeing is, I'm seeing a year and a half in delay of care. People, they were scared to go to a hospital. I don't fault them. I'm scared to go to work every day. So, so a lot of people put back their, like I said, on Uncle Mel and Uncle Charlie show, when I did come on, people didn't do critical testing. If it was, getting a CT chest, keeping up with lung nodules, right? Even if it's like, nothing of severe, you kind of watch it, right? You watch it, you do CT chest, and people weren't coming in. People were not coming in because they were scared. So, okay, so we fast forward a year and a half, I'm seeing more and more referrals of people that had mild diagnosis to now they are severe, and some even terminal. So then you have, in the pandemic, a lot of specialists in, that were elderly, well, old enough to retire. They left their specialty. So when you have that group of people, so we're losing providers in specialty care. Let's talk about respiratory, right? A lot of people don't know that we don't have a lot of pulmonologists. I'm sure Dr. Kapono knows, but we don't. Our main hub or biopsy on like lung mass is Oahu. So, you know, again, a year and a half in medical care delay, and all of a sudden, you know, people are feeling a little bit more confident because they got their vaccine. So they're going to their critical tests and everything. And all of a sudden, you know, it's like a nausea a mass. Stage COPD is like 4. You know, people are having shortness of breath. People are getting back in the community and they're getting asthma attacks. I mean, you have all these different factors, and all these referrals are coming in. All these referrals are coming in, and we don't have appointments. I think for routine appointment, I'm booking in October, and these are people with shortness of breath. Shortness of breath could possibly need an oxygen tank. Our hospitals, our beds are full. You know, when we hear leaders talk about, oh, we don't have a lot of COVID beds, right? Our cases are low. But what about the beds that are filled for non-COVID illness? The year and a half of delay in care, these people are sick. So we don't need to spread this virus. We don't need more cases of this variant. Where are we going to put them? Where will we put them? Okay, we put more beds out, but who's going to staff them? We don't have a lot of critical care nurses. We don't have a lot of critical care providers. I mean, we need to control this variant. You know, and then you have, you know, people, they have vaccine hesitancy. You know, you can go on IG and somebody is an IG medical professional, right? I'm sure Doc Neecey, you know, they think they know. All of a sudden they're epidemiologists, and people are buying into that. And I'm not talking about people that cannot get it due to, you know, they have medical issues, or even if it's against their cultural religion, whatever. I'm talking about people that are believing these, I don't know, these hope of these people just chips in your arms and all of that. It's like nonsense.
I mean,
You know,
that's
I
part of
remember-
the issue with, like, you know, having mixed messages and not having clear messaging from the top down with like leadership, because people will believe whatever they want to believe.
Yeah.
Like Dr. Kapono, like with your experience throughout the pandemic and with dealing with different patient populations, like have people been coming to you with a lot of just misinformation questions and things like that?
Oh, of course. You know, I mean,
Yeah.
particularly with a vaccine, you know, I zombies, you know, I mean, it's some of it is
definitely
so
got a zombie
silly,
question.
like, yeah, I mean, you know, it's gonna make you into a zombie. You know, I'm telling them, well, when I turn into a zombie, I'm eating your brains first.
Totally.
I'm like, but you know, there's all kind of things that come out. You know, a lot of my patients, there's kind of 2 categories I sort of think of. There's the Christians mostly that sort of have this, I want to leave it to God kind of viewpoint on it. Or some of them have shared that someone in their congregation shared that, you know, God sent me a message and told me that he would protect us from COVID. And that was earlier in the pandemic. And I can see where that message is a useful message with all the anxiety and you know, in a religious community, you know, but then it sort of was like, wait, is this backfiring now? You know, so if I get a vaccine, does that mean that I'm saying I don't believe in what that person said? One of my colleagues shared this parable about I think it's called the drowning man. But you know, there's a man. I read different versions of it, but the version that I first read was a man is in a house that's getting flooded. He's on the roof. and the waters are rising, and he's praying to God to save him. And a man comes by in a canoe and says, "Hey, get in here. I'm going to get you out of here." And he says, "No, I'm praying to God. I have faith. I'm waiting for God." And then, another man comes by in a motorboat and says, "Come on, get out of here. I'm going to save you." He's like, "No, I'm waiting for God. I'm going to have my faith." A guy comes by in a helicopter and offers the same thing. "No, I'm have my faith." He ends up, waters rise, he drowns, goes to heaven and gets to talk to God and asks, "Why didn't you save me?" And God said, "I sent 3 people to save you and you didn't go for it." And I just try to encourage people to think about that. It could be a change in perspective. And I'm not a very religious person, but I think that, you can think that a lot of this stuff that was accomplished, you could easily think there had to have been a higher power involved. I mean, who could have gotten some of these? I would frankly say a lot of these vaccine companies, I don't like them either. I don't like big pharma. I don't trust those guys, but they cooperated for once.
Yeah, they finally worked together
to get this done. And I don't know who else, without some help, could have gotten something like that done. So, I try to have that dialogue with my patients and always and not shut the door, and always kind of say the door is open. We want to make it easy for you. Think twice about it. The other people are the conspiracy folks, like you were saying, or a lot of Native Hawaiians, just ever since the overthrow, our kingdom was overthrown illegally. A lot of it came from American businessmen who, wanted to profit from our islands in however way they did. And you can look at it a lot as a reaction to what Queen Liliuokalani did in response to pandemics. Same thing, smallpox. She lived through measles, and so when smallpox arrived, she was like, "Shut it down." They didn't like that, and so when they didn't like that, they ultimately overthrew and took over Hawaii, and so we're still living in essentially what is an illegal overthrow. Technically, it's an occupation by the United States. But as a result, I think
so are we.
There's a viewpoint from I think a lot of Native Hawaiians that I don't trust the government, and they're the ones that telling me to get the vaccine. I'm not a sheep. I'm not a minion.
Yeah.
I don't want to be part of this thing where, oh, well, if we get to this tier, that means we can have all these visitors back that were a problem before the pandemic started. Our politicians didn't inspire us to feel that they cared about us, anyway. And so, and they feel like they're kind of being, I think, complicit in that whole, what the man wants me to do kind of feeling.
Yeah, totally.
And so I totally sympathize with that. But I, at the same time, I try to help people understand, but that's not a good reason to not get vaccinated. We still, this is our best weapon. Make our community strong. If that's your viewpoint, it's time to speak up. We have the first Native Hawaiian to be the head of the Hawaii Tourism Authority, which really doesn't have that much authority. But we have, we have more chance now, I think, than ever before for that voice to be heard. And so get vaccinated, keep our community safe, but speak up if that's what your viewpoint is. And I would encourage, I also, sorry to keep taking so much time, but I also feel like it was a reminder to residents that are not Hawaiian, that, Hawaiian sovereignty is what we tend to talk about, the people that feel, the colonial power that overthrew our government, that it was not pono, and that things should be made right. To me, it's not, it's kind of always been couched as a Native Hawaiian issue, and Haoles go home, and if you're not Hawaiian, beat it, get out of the islands. But to me, it's more about, do you view Hawaii as your piko, like your center? Your piko is like your belly button. But do you view Hawaii as your center? And do you think that policy should be made based on Hawaii as the center? Or are you okay with the way it is right now, which is essentially we are a peripheral appendage to the United States, and they treat us that way, and our politicians are somewhat content to go along with that. So I think that was a wake-up call for me during this pandemic.
Yeah, for all of us, I think. Angela, I wonder if you could touch on that for a minute, because something that we always talk about, is just this phenomena of the super spreader, the belligerent, willfully ignorant super spreader, and how one thing that no one ever really says aloud, you know, is that we could have done a better job on everything, but specifically on, you know, controlling infection and containing the virus, if we as a country knew how to say no to white people, right? But we can't. We don't know how to say no to them. And I wonder, like, with all of the issues of like travel, I mean, when people in the mainland, you know, probably think of Hawaii as one place, but it's actually like several islands. And then also, you know, there's other communities, Micronesian communities and Filipino communities, other Pacific Islander communities. Like, what are these like sort of separate like nuances of, you know, communities that are being forgotten, or places where vaccination is lagging behind? Like, how are your efforts sort of focused on protecting the most vulnerable?
You know, we started with quarantine, but once I realized that there was so much more to the pandemic than just quarantine, we branched out into lobbying for a statewide mask mandate. Then we started looking at where are gatherings happening and how can we prevent that from happening, because that's just part of our culture, it's to gather. And then we've got these young people taking advantage of the pandemic, having these huge parties, bringing in a rapper for 50,000 and cramming 500 kids into a building out in the country where nobody could find them. You know, there were just so many. It was like, for me, and I think Mel and Charlie have heard me say this many times, there's so many holes in the bucket, right? With this pandemic in Hawaii, and you plug one hole and another one pops open. And, you know, one of the first things that I did and we talked about the Hawaii tourism industry, when John DeFries came on board, was, first of all, we had zero compliance with the mask mandate. Once we got it passed, I was lobbying to make it statewide, to make it a done deal, that people would actually get ticketed for this and get in trouble for it and be compliant. It still didn't work. And then one day I saw John DeFries get up at a press conference with the governor at the airport, and he said, I had been bugging him, poking him via email, text message, however I could. And he finally said it, and he said, hey, mask mandate is the law of the land. You know, it's an HRS, Hawaii revised statute, that people have to follow it. And it's been a constant struggle, whether you're a traveler coming in or whether you're Indigenous, Pacific Islander, Filipino, all these different fractions who have different cultural beliefs, different religions, different family pressure, you know. And so you've got to keep plugging those pukas, those holes, and figure out a way around where we can all unite for a better cause. And that's really what our group does. If somebody's complaining, I want them to do something about it. I don't want them to just grumble about it in the group. I tell them to email me. Let's figure this out. Let's figure out how we can get into this and get it resolved. There's so many different cultures where we all kind of live in harmony for the most part, but we all have these different things, you know, whether it's our religion or whatever we're dealing with. And if we have all these people on all these different islands, we have an opportunity to make a difference. And as we move past the pandemic, eventually in the coming years, my goal is to continue to continue with all the members and continue pushing people to be pono, as Dr. Kapono said, to be pono, to be right, to be proper, to have that respect for Native people, who have the respect for the Indigenous people. And we just plug at it every day, every day, every day until the end happens, you know? So I hope I answered your question.
Yeah.
Uncle Charlie, through you guys' platform, are you seeing hesitancy issues in various communities? How do they differ, and what are you trying to do to address the various types of hesitancies that are out there on the islands?
I think the most important thing that we try to do, first of all, is just get the information out. Because we find that if we push too hard, we as the voice, you know, Mel and I, we consider ourselves a voice because, you know, we're speaking up for the little guy. If we start getting pushback, then we lose that momentum from everyone who's affected. Because there are a lot of people that have a lot to say, but sometimes, I mean, Mel will tell you right from the get-go, we push hard against the lieutenant governor, and he publicly calls us fear mongers and starts bashing us. So when people see that, they want to participate, but they don't want to be part of that. So that's why we have to maneuver in such a way that we say, hey, everybody has a right to say what they want to say, right? But we just want to push the information out there. So to answer your question, in our community, a lot of the communities do see things happening. The question is, we get the feedback on the back channel, maybe it's through a private chat, but nothing will come up in the forefront. I think sometimes it's important so people can see the magnitude of how things are moving. But again, people, Hawaii, and for one reason or another, they just don't want to get into that arena because they know there's going to be a battle going on. So, of course, Mel and I, we're always up for the challenge. So he said, hey, what the heck, let's go for it. And
No, you know,
become-
there's this delicate balance that you have to have as an advocate and educator, right? And there's so many things that you want to say, and you know, Dr. Hudson and I go through this all the time. So many things you want to say, and you know, you may end up saying it as a person, but you try not to say it as an entity because you realize that you don't want to push people away, and you want to get as many ears as possible to listen to the important messages. So in the same vein, how has that delicate balance worked for you all? How have you guys been able to navigate that so you don't lose the audience that needs to hear the messages you have to say?
I'm still trying to master that art. Charlie has the reel. You know, he knows my buttons. I know his, and it's Charlie's much more mellow than I. Yeah, the yin and the yang. I mean, that's it was probably last year when we were talking. We do a post-show critique every night, and we realized that we definitely was a yin and a yang because he knew when I was headed for disaster, he would be able to pull me back in, and likewise.
Oh, Mel's the Neecey of this group.
He's the radical, but then gummy bear, and then Uncle Charlie's like, "Oh, now Mel, come on!" And Uncle Charlie
until Uncle Charlie gets angry, and then
oh no,
yeah, it's fun to watch. It's I could push his button
Uncle
right now.
Uncle Charlie is not. It's like you see him, and then he giggles. He has this laugh, and you're like, "Ooh, Uncle Charlie, mad."
To answer your question, though, I you know, you're right. We have definitely lost some viewers. You know, we've had, you know, we've picked up a lot, and it is a delicate balance. And for us, it's really getting the information out. Charlie and I, yeah, we may. And oftentimes we will share our opinion, but it's always, we have tried to be in line with what Dr. Kapono is trying to do, or our mayor is trying to do. And we've brought the mayor and our health director on numerous times whenever they're going to open up a new testing platform or a vaccination. They have a free invite to come on anytime they want. But I think, you know, what the challenges we have and what we have to fight. And I heard, what's his first name?
Jonathan.
Jonathan, sorry. Jonathan kind of mentioned about this earlier, but you know, in our state from the beginning, and I think everyone else here will attest, and if you disagree, let me know. This state has constantly blamed the local people for the spikes. It was because we weren't wearing our masks, because we weren't social distancing, because we were gathering in gatherings too big. They never talked about the the visitors. And then the most despicable thing was when we had a cluster, and this happened on more than one island. We had one here on Kauai. It was a pretty big cluster, and Oahu had a similar cluster, obviously non-related, but of the Micronesian community, the Pacific Islander community. And they had the audacity to basically say the reason why they are vulnerable is because of the way they live, because they live in multi-generational homes. Like, holy crap, that, you know, we lived in multi-generational homes all my life. You know, we live with grandma and everybody. That's how it is over here. It's expensive. But when you know, when the government comes out, how does these people feel, right? I mean, you're like, now you're blaming me because I got COVID. You're blaming me because I got COVID because you cannot protect our borders.
Which is absurd, because basically you guys are like this nexus of variants from Brazil, the UK, India. How did they get there?
There's only one way. There's only one way. But you know, again, it's always let me know if you guys feel differently, people from Kauai or Melissa, that it was always spun right back to the residents. And when they went after that Pacific Islander community, I thought that was so tasteless. And that now you coming back and said, hey, trust us, go get a vaccine. You know, I cannot do it on your show. I would do it on our show, but I'm not going to do it on your show. But yeah, I'd flip them a double bird and say, go, you know, let's good.
I went to all the time. Yeah. Yeah.
Now,
I mean,
if I can piggyback on that, Mel, I think you're right on. I mean, that's exactly kind of what I was alluding to too. And, you know, one of the good things that came out of this is our Micronesian population, the Compacted Free Association, they were also not eligible for Medicaid. So they're uninsured, you know, I mean, and that decision was made finally, you know, at the federal level to allow them to be eligible for Medicaid again. I think it was in January. But we learned that, you know, you can't exclude a certain subsegment of the population in a pandemic and not have it bite you in the okole, we would say. But, you know, like they don't have access to care or testing, you know, and our community health centers try to bridge that gap and reach out to those people. So, and Mel is completely right too. One of the biggest bothersome things was that with safe travels, our proponents are trying to say, oh, it will be 1 in 1,000 travelers that get through safe travels as positive. And all the experts that had done analytical models based on the community prevalence in the states where people were coming from, based on evidence from Alaska and what had happened there with a similar program, we all calculated it out about 6 or 7 per 1,000 is what we were going to see. In hindsight, Maui's district health officer did a departure study. So he tested people as they were leaving from Hawaii to eliminate that bias, because tourists don't want to be tested, right? You're positive, you ruin your vacation that you might have saved your life for. And so there was kind of like some real bad misinformation coming from proponents of safe travels about, you know, how many negative tests there had been, and the local media was not being, they weren't using discretion as far as what they were promoting to the public with those things. And so we found out that that was the truth. So 6 or 7 times higher than what the proponent said. So who do you blame when you say that it's going to be so much lower and then the case rates rise? Blame the locals, you know, and I learned in private, because I'm part of other meetings, that was the plan before it even happened.
Yeah.
You know, I mean, as soon as safe travels happened, there was an admission, oh yeah, we'll probably have a spike after Thanksgiving and it'll be after Christmas, but it won't be because of travelers. It will be because we're restarting the economy. It'll be because of locals. And it's kind of like, well, because of locals working in the visitor industry that you're and then, you know, like, and then taking it home to their families. So I mean, it was just so disingenuous. The last thing I wanted to say about Mel and Charlie's show, you know, is that what I think they offered was they had great, I mean, I couldn't believe the guests that they were getting on. You know, it seemed like a small show, but they had these experts, but Mel and Charlie have a great, it must be some of that poragi, but I mean, like, they have a great way of getting people to speak openly, and Mel no matter whether you like what he says or not, he's genuine. You can tell that they are genuine people, you know, and that's what people appreciate. Even if you don't like the opinion, you can tell they're genuine. I think that's what the viewers appreciated. And they watch the comments and then ask the questions to the experts from the comments. So they were key in bridging that communication gap between experts who don't speak the same way that our local people do and communicating in a way that our people could understand. That was hugely valuable. So I wanted to give them a shout out for that.
Yeah, they're amazing.
Thanks, Doc. That was nice. That was nice.
I would like to say that, you know, a lot of the problems created when we are on the show is actually created by Mel. And my job is to keep an eye on I'm surprised.
I love the way they love each other.
He's on the rails tonight. He hasn't gone off the rails yet. And
This is such a different show.
I was like hoping for that. Like, I'm tired of being reined in. I haven't dropped an F-bomb in weeks.
Just give me the green light. Give me the green light. I'll snap. I can snap on cue.
I mean,
like the best show ever. It's so
tell me what's going on. I mean, yeah. I mean, it sounds like a lieutenant governor is like super great.
I'm super what?
Great. He sounds like a great guy. No, I'm kidding.
She was trying to
about
get
to
you
go
to
off there.
F-bomb.
I know. I was like, what? Say what now?
Woo!
Hang
on.
Oh, you see,
Drink your coffee.
Mel will let you know when he's ready to tee off. Me on the other
The
hand,
Ray said, fuck a what?
Me on the other hand, I'm just watching Mel like, okay. 10, 9, 8, 7, 6, here it comes.
No, you know what I want Mel to talk about? I want you to tell me, like, if it was up to you, if you could, or not just you, but like
meet your twin,
right? What do you think, you know, besides like cracking down a little bit more on tourism, what other measures need to be taken to prioritize saving lives over the economy?
I think for me, and I said this from very early on, that the inconveniencing a traveler, and we're not just talking about visitor travel, but you know, local residents travel too, and they come back home with virus. But inconveniencing a traveler or visitor should not even be in the equation when we're talking about health and safety of our residents. It just shouldn't be. I mean, you know, if our decision to protect our people, especially our kupuna, which is our elderly, and our keiki, which is our kids, then I'm sorry, you're gonna be inconvenienced. Go somewhere else. I mean, it's that simple. Go somewhere else. But you're coming to a safe area. I hear the visitors complaining about the lines that they gotta wait in, or we have a shortage of rental cars. Hey, don't blame the local people. You guys came, you chose, you wanted to come here. But I think we have an opportunity right now, as far as with this variant, to really keep our people safe. But the decisions got to be made without any kind of compromise to our safety, because we don't want to inconvenience the traveler. And I think that's where everything has been. All decisions have been made from that press conference I talked about back in March. Was all decisions were made to the advantage of the visitor industry, understanding that's our backbone, that's where we get our revenue. But when we put our local families at risk because we want to get people back to work, or we want to generate more tax revenue from visitors, that's the wrong road. So if I had to make the choice, the testing would still be a requirement, the pre-departure testing. I don't care if you're vaccinated or not, because, you know, we there's no way of us verifying the vaccination card. Starting July 8th, anyone can fly in with a vaccination card, which you can buy on eBay, actually, already completed. But there'll be no way to electronically validate or verify. So we're going to see a lot more cases. So I think the pre-test is still necessary. I think the pre-test is one of the things that kept Hawaii relatively with relatively low numbers. So that's kind of what I would do differently. And of course, I would assign the lieutenant governor to another function and not to be a COVID liaison. I seriously, and I trust me, he's the guy who's my friend. I don't think he likes me anymore, but we were friends.
Yeah.
And he was one of our strongest advocates, as Charlie
Yeah.
said. And then
Yep.
just like that, it was gone.
Angela,
Hope I answered your question.
you did you did very well, Mel. Angela, I often believe that while it takes the people within the community to fight to protect themselves, if we can reach out and get cooperation from others to understand what our issues are and fight those issues as if they were their own, it gives us even more power. So how can we as mainlanders understand what you guys are dealing with in Hawaii so that we can put pressure on the folks to focus on keeping you guys safe there?
Education. That has been, you know, as a medical news reporter, that's what I did for most of my career. And education is the first thing that I went after when I talk to state officials. It's the one thing that I talk about with foreigners, with, you know, people who don't live in Hawaii. Once I say this, they're like, why do we have to wear a mask? You know, hey, we have indigenous people. We don't want to see them in a museum. We want to see them and keep them and their culture flourishing. And the one thing that I've pounded the pavement with every state, county, city official, every person that I meet, I talk about the education. When a person books a ticket to Hawaii, they've got to have that pop-up that says, protect our Native people. This is why we're so fastidious. This is why we're so vigilant, or as the Hawaiian word is maka'ala, vigilant. Whatever you do, share a post about educating others that we have indigenous people, we have a culture, we have plants, animals, and insects that don't exist anywhere else on earth. And if we don't take care of them, it won't be here for generations to come. It just all goes back to very simple: no Hawaiians, no Hawaii. So whatever you do, spread the word, explain to people why we are so careful. And once I do that, it seems that people get it. It's that entitlement. It's the Disneyland vision of Hawaii. It's that Riki Tiki, you know, the tikis, the grass skirts, the fake hula, you know, that people think about at the luau that they're paying for. That's not Hawaii. What it is it's about our indigenous people, what they hold close to their heart, and that is their ohana, or their family. And without keeping them safe, there is no Hawaii. So just spread the word for us if you can.
We will. Melissa, how can people start to like advocate for themselves, not just patients, but people in the community, to be able to get access to the resources they need and to sort of help push back and encourage safer practices?
I think we need to stop thinking about, you know, me and think about we. We have to help one another in this pandemic. I'm tired. I'm tired of work. I'm tired of seeing people sick from COVID, non-COVID. We need to help one another. One thing I did see when the pandemic started was, you know, we had a shutdown, we had a lockdown. A lot of people lost jobs. A lot of people lost medical. You know, you had communities that didn't even never had to apply for you know, Medicaid, right? They have no insurance. They didn't even know how to apply, you know, to access to care. And then we need to help each other, right? Encourage each other, you know, especially our elderly. Kupuna. A lot of them, you know, they need help to navigate the healthcare system. I remember when this pandemic started and we had to go from like in-person to telehealth. Oh my goodness, this stuff, you know, they don't know. I mean, a lot of our elders have, you know, those old school phones, right? It's not a smartphone and everything. So, you know, we did our best to teach them. Then we had people that, you know, applied for Medicaid. State didn't hire no emergency workers to process these applications. So you had a lot of people, you know, not wanting to go to their appointments because, you know, in Hawaii, as soon as you apply for Medicaid, even though it's pending, when you get eligible and you get your Medicaid, they will retro, like from when you went to your appointment. A lot of people were scared, like, I'm not coming in, it's pending, but I don't want to get caught with a bill. You know, right now, I try to tell people, you know, the stereotypical, you know, vision of poverty. It's a different view. It's from poor, middle class. I've even seen people that, you know, had it all. I mean, they don't have a job and now they're like, oh my God, like, how do I apply for Medicaid? You know, so it's just across the board. I think we really need to help each other. I think we need to keep this variant down. Keep this variant, oh Lord, keep this variant down, because our hospitals are filled with non-COVID patients. You know, people that are suffering because a year and a half in delaying care, people are sick. So we must focus on mask wearing, getting our vaccine, you know, and this is especially for the island of Oahu. We need to keep this variant down because we have people like people from the neighbor islands, Kauai, they have what, 9 ICU beds? We got Maui, we got all these other neighbor islands that they're gonna, if they get sick for non-COVID, they need our beds. They're gonna come to us. So we can't stop thinking about me. We got to think about we. How are we going to protect each other? How are we going to get through this pandemic? I love every time Jonathan comes on with medicine, and he always focuses on help us, save us. We can't depend on our leaders. We cannot depend on politicians. It's all of us. And one thing I loved about Uncle Mel and Uncle Charlie, they created a village, like the most powerful village I've ever seen, and brought in like these amazing experts. 2 uncles from the island of Kauai, okay? You know, I always tell them, like, you know, I'm not a doctor, but you gather doctors from around the globe. You know, I mean, come on, I would never think in 1,000 years that we would have Uncle Charlie, Uncle Mel, Sis Angela, Dr. We are on hood medicine. You guys are on the mainland. You know, Doc Neecey, we've been friends. This is before this whole pandemic. You reached across the ocean, your arm, and built a bridge. This is pretty amazing. You know, we're all coming together for one mission, one focus, and it's to save us. Whether you live in Indiana, whether you live in Chicago, you know, Aloha is worldwide. And I just want people to stop. We need to think about each other. We need to think about, we got to get through this. And unfortunately, we can, there's going to be our leaders, there's going to be our politicians, but at the end of the day, it's all about us. And we need to encourage each other. We need to love each other. We need to educate one another. When I did my shot, I videoed it because how we talk about, like, Dr. I mean, you're a mad scientist, right? I mean, you have all this scientific knowledge, okay, that you want to share. But trust me, when you got your vaccine, it was because they saw you do it and they trust you. And when I got my vaccine, I encourage people, it doesn't matter what the CDC says. It doesn't matter about what they say, what's in the vaccine. It was because I built a friendship with people. They know I will not steer them wrong. So when they seeing me get the vaccine, they know I'm not gonna do them wrong. Why am I gonna put you down a road that's gonna harm you? So a lot of people that saw that video, they're like, sis, I wasn't gonna get it, but I know since you got it, like, I trust you, a village.
Yeah.
And that's what I want people to do is, hey, you wanna believe all these conspiracy, whatever, like, but look at the people on your timeline, on your Facebook, people that you love, respect, and trust. And they're sharing their stories of getting this vaccine because it's not about them, it's about us. So that's what I push. That's what I tell people. You don't want to believe, the whole American, that's fine. But if you love me, believe me. And I want good for you. I want you to be alive. I want you to stay safe. That's all.
I love that. That's why Melissa has the biggest gorilla heart in our whole organization.
That's gonna be
Melissa has donated with her own money PPE for so many organizations and people that no one even knows about. When we had the big clusters at the jail on Oahu, she took disinfectant, she took PPE and gave it to the state agency on her expense because the state couldn't even provide that for their employees. This woman is an angel. When she came on our show, Charlie and I call her the angel. She's one of our original angels on our show, and she continues that every single day. So we love you, Melissa.
Yeah, we love you too.
We call her Robin Hood.
That's a way to describe Melissa. Yeah.
She puts the Robin Hood in Hood medicine for sure.
Uncle Mel, Uncle Charlie, as we wrap up, just want to get some of your closing thoughts on, what we need to do as the Delta Plus variant starts to spread. Your closing thoughts on how we can keep the community safe, and what more work we can do to help protect Native Hawaiians.
Well, I would first like to say thank you very, very much for having us on. And my whole thinking is this is it's a real difficult journey. And the only reason why I say it very compassionately is that as long as, Mel will tell you, I've always been one that it's always got to be about the messaging. You got to put the message in its right context. And we see too many times that, and we've said it before, when you have people in high places giving the message, if you don't know any better, you would think, hey, they must be right. The person's a doctor, so maybe what he's saying is right. And yet there are individuals like us that, because of our background, we just love to pick at that little scab because there's something under there that doesn't sound right. And we keep on digging and digging, just like Angela. She knows when there's something out in a community that doesn't sound right. When the hair starts standing up in the back of your, your head, you know you're onto something. So for everyone out there who's watching, this segment, you got to know what you do to take care of yourself, because they're not going to do it for you. They're going to tell you something else. They're going to tell you that we are on a course right now to open up Hawaii completely, regardless of how many cases are reported. You know, if we were doing so good, we should have 0 cases. But every day we get 45, 50, 25, 65, and with everything, they sensationalize it, but yet they do it very calmly when they say, oh, but we had 2 more deaths today. See, that's the thing that bothers me. You always go, every day you're going to get a death, and it's like clockwork, but they say it very quietly, like they'll talk loud about other things. When it comes to the death, he's like, oh, but we had 2 deaths. And they try to spit it off that underlying conditions. The thing is, you know what? The person didn't catch COVID. That cycle wouldn't have started. But they're in there because of COVID, right? So we got the Delta variant. All we can say is you got to take it seriously, gang. Because like I said before, you can play around with dangerous stuff, but once you get tagged, you're going to get tagged really hard. And, you know, today I was looking at my brother's picture because he was reminding me, you know, my son was on Kauai this whole week, and I didn't get to spend one time with him. And I would be remiss if I didn't say I'm no longer with Star Protection Agency. I took over as the new security manager for the Lāhui Airport. So I handle all the security for the main airport on Kauai. And so I've just been working all week, and I didn't get time to spend with my son. And I looked at my son, and I even told him, I said, man, you remember the time we had a nice time with Uncle Eddie? And even my son got taken back. He said, you know, Dad, why did COVID have to take him? I said, I don't know. I don't know. So I just want everybody to be, you know, safe. And Mel would probably have a lot more to say than I do. So I just want to turn it over to Mel. And again, I want to say thank you to both of you, Jonathan and Dr.
Love you,
Hudson.
Uncle.
Thank you very much.
Thank you.
You know, seriousness, Charlie, you know, Charlie's brother's unfortunate passing wasn't in vain, because Charlie took us on that journey with him. And I remember, I'll never forget when Charlie called me one morning. He was so happy. He said, hey, my brother's doing better today. And then he died. But that loss of his brother created Charlie, who has basically given up himself now to share the important messages of COVID. So yeah, you know, we still pray for Charlie and his family, Ohana. But you know, we every night we say the same thing on our show. Every night, guys, we got to take it upon ourselves. We gotta make sure we're vaccinated. We gotta wear our masks. We gotta social distance. We gotta disinfect. We gotta take care of ourselves. We cannot rely on the government, because they ain't gonna do it. They have a different priority. Their priority is not. Their priority is opening up the state. So, and they're expecting us to do what we got to do. So I just take them out of the equation, focus on us, and do what we got to do, and we will be okay. It's just unfortunate that others will die, those that are less fortunate and vulnerable. And really, in closing, I just want to put this up, because you heard some words tonight that I'm sure you didn't know what the hell it was. So
I love it.
I love
just
it.
real quick,
I
this is
love
just,
it.
you know, Pono. Pono is not the second half of Dr. Kapono's name. Pono means correct. The thing is, the Hawaiian
That's
language,
right.
the one word means, okay, so Pono is correct. Puka, you heard puka, that means a hole, like a gap.
Mhm.
Hui, the hui is a group. And I bring this up because I want you guys to use this in your presentations going forward. I'm going to be watching. Hui is group.
I love
Pilikia
it.
means trouble
Trouble.
or concerns. You know, don't bring your pilikia over here. Pico is the core. It's like your pico is a little umbilical cord, your belly button. That's the pico, but it means your core. Keiki is youth. Kupuna is the elderly. Okole is the butt or ass. Your ass. So we have a so we have a shirt. And keep an eye on that. Now we have a shirt, and I kind of mixed up the words, but we have a shirt that was made that we sold for charity and we made a lot of money. It says, "Don't be an okole puka." So you see okole? Now you and
I love
puka.
it.
But yeah, feel free to use these words in your future
I
presentation.
will be.
Pono, you know, to me, I think aloha, everybody knows aloha. Aloha means so much. Hello, goodbye, love, all of this. But pono, to me, to get through this crisis, pono is the most important word, because we gotta do things correctly. We gotta do things right. And that's my final thought for the day. Thank you so much. Thank you.
Thank you. Dr. Kapono, why don't we go to you next, so that we don't have technical difficulties.
Sorry. Yeah,
No, it's good.
that's my fault. But yeah, battery ran out, but we're back. I might piggyback onto what Mel said. So our motto, the state of Hawaii motto, which was borrowed from the Kingdom of Hawaii, is "Wamau ke'eo ka aina I kapono," is that the life of the land is perpetuated in righteousness. And so it means that it's emphasizing that proper behavior, acting, right towards each other, is the way that we keep our land healthy. And aloha is very important to us, but that's not the motto. I would probably say pono is maybe the only concept that might be above aloha in our culture. I wanted to share that because we're safety. We are safety first. That's basically what we're saying is safety first in this pandemic. But that doesn't mean that we don't like visitors, and people like you, Jonathan and Neecey. The reason why Hawaii became popular is because Polynesian culture is notoriously hospitable. We like hosting people that respect our culture. We like showing them a good time. I think part of why Hawaii became popular is because in the beginning, like my grandparents' generation, you're just from somewhere else, new person. Tell me about your life. What are you about? Come inside, have some food. These are old principles coming from our culture, and that is what fueled, I think, part of our tourism industry. The problem is it can be ruined when you have people who don't give back that respect. So because your show is not so Hawaii centric and might have viewers from other people, it's not saying that we don't want visitors. My take on this is that we would love to just have, even if it's a little bit more difficult to get through, fine, because it's going to select for people that want to come to Hawaii for the right reasons, not just that it's a beach, not just that there's good weather, there's this unique environment, there's this unique culture. You can have a wonderful experience, but it sort of hit this critical time where we're kind of overloaded, and I don't think it can continue the way that it is without having changes that we don't want to see. So I do want your viewers to know that, I had visitors that came during the bubble resort, my friends from college, they were saying, I'm not sure how you feel about this, but my wife just got through breast cancer treatment. We really need a break. We really want to come visit. And I'm like, I'm going to take precautions. You take your precautions. But yeah, once you're through it all, let's get together, and I'm going to show you, the best time I can show you, so I wanted to share that. The other word I wanted to share is mahalo, and you've probably heard it used pretty loosely as a translation for thank you. But the way I was taught about mahalo is it's sort of a deeper gratitude than thank you. It's not just a, thank you for every little thing. Mahalo is really deeper gratitude. So I wanted to say mahalo to Mel and Charlie, and then the two of you. I feel like you guys are similar in the role that you're fulfilling, different styles, but similar, and Melissa and Angela were part of this too. But you're creating communities, you're creating venues where truth can come through in this era, this post-truth era of misinformation and all this pilikia between, whoever, different factions as far as their viewpoints, but you're creating this venue where people can share information, and you're doing that for these vulnerable populations. So I really just want to say mahalo to everybody who's on this show for what you've done for your communities, and how that can affect our communities. So mahalo.
Thank you. Angela.
Wow, how do I wrap that? Oh my goodness. I think we're all part of a beautiful quilt of many colors and many fabrics and many stitches. I think if anything, we have sort of come together to realize that we're all in the canoe paddling together. Some canoes may be different, but the canoe thing is a big part of Hawaii and her culture. That's how Native Hawaiians got to Hawaii. So the main thing is to put those paddles in the water and to continue to move forward. And there's a Hawaiian saying, pupukahi'i holomua, which means to unite and to move forward. And when we put those paddles in the water and we're all going in the same direction, nothing but good can happen. And I think that that's what we'll all continue to do. And we're so grateful for you all sharing about Hawaii, because that helps us get the word out about who we are and what we do and why our culture is so valued and why the Indigenous people are so vital to the life of the land.
Thank you. We're so excited. I think we lost Charlie maybe, but we're so grateful to have everyone on tonight and so happy to have met all of you. We've heard so much from Melissa, and we've been watching Mel, or at least I've been watching Mel and Charlie. So we're super.
Real quick, if I may, real quick, because Charlie's not here, and he usually gets really upset when I bring it up. But after COVID is done, and I thank Kapono for clarifying.
Oh my God, big party!
Yeah, that's it. You got me, girl. So, Kapono, thanks for clarifying about we're not saying we don't like tourists. No, we just don't like the junk ones. We just want the good ones that can respect our culture. That's all.
Yeah.
Because really, I mean,
I can't wait for you guys to come. He's gonna get us a Ferris wheel.
What?
Portuguese. I am 100% Portuguese. I am not a drop of Hawaiian or Pacific Islander. But we're sixth generation here. I don't even know my Portuguese culture. I only know the Hawaiian culture. So that it is what it is. But
you are us.
When COVID is gone, when COVID is safe, Charlie is putting up the state's largest free concert here on Kauai at the stadium.
All islands.
All islands. We'll start on Kauai, but the two of you are invited to come join us.
Oh my God.
I'm there.
Yes.
I'm there.
I'm there.
And there's going to be entertainment, food, every kind of food, Hawaiian food.
I will eat every kind of food. Thank you.
Yeah. Anyway, I just wanted to
bumper cars.
The work.
That would be amazing.
Yeah, I have to echo Dr. Hudson, and I'll say it this way: mahalo. Because we are deeply grateful for your stories. I think the only way we can really connect with one another throughout this pandemic is understanding our shared stories, our shared sacrifices, our shared tragedies. On behalf of Hood Medicine, you can tell Charlie that we ache and mourn for his loss. Every life that we've lost to COVID, particularly the ones that didn't need to be lost, is a pain for all of us, and it hurts for all of us. So we send our deepest sympathies to him and his family for the loss of his brother. But we thank you all for using that moment to empower so many people on the islands to do better, to be strong, and to fight this as best they can so that you can protect what is important in Hawaii, and that's the Hawaiians. So thank you so much. Closely, we want to say at Hood Medicine, we want to bring you trusted individuals to provide you with the facts and information to allow you to make the decisions necessary to keep you and your family safe. Please follow us on Facebook, Instagram, and Twitter to support our effort. donate to our cause, or find out about our next events, you can visit us at hoodmedicine.org, at hood_medicine on Instagram or Twitter, Hood Medicine Initiative, all one word, on Facebook. Thank you again. Stay safe, and please get vaccinated and be concerned about communities that are not your own. Thank you.
Aloha.
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 Bye, everyone. We did it, Neecey.